Hi, everybody. Welcome to our Community Cats and Coronavirus pop-up panel. Good afternoon. Thank you so much for tuning in. I see the numbers building up out there with regards to the attendees. So thank you so much for tuning in. And I am going to ask Kelly and Amber, if you can turn off your cameras, that would be great. Michelle, I'm going to have you stay on as you are going to be the first speaker. Kristen, are you out there? You want to say hello to everybody?
I am out here. Hi, everybody.
So Kristen is with us today, making sure that anybody, if they're having any problems or questions, please put it in the questions box. Can you put into the questions box right now? If you can see and hear us, that would be great, just to do our little sound check and make sure that all is well. And once we've got that, if you want to introduce yourself in the questions box, please feel free to go in and say, hey, my name is Stacy, and I am with the Community Cats podcast in Vermont. And excellent, Julie Jacobson, hello. She's the Community Cats grants lady. Thank you so much for tuning in. In Vermont here, we have about 4 or 5 inches of snow, so it's back to winter for us. So I hope wherever you are, the weather is much nicer and much better. Catherine, hey, so good to see you out there. She's with All About Animals Rescue. I wonder who she's here to listen to today. And hi, Ruth from New York. Excellent. Good afternoon. Good afternoon. Thank you so much for tuning in. Appreciate it very much. So we have a great lineup today, and I'm going to go through that in just a minute. Lois, hello from New York City. Thank you for coming. And Holly is here from Lansing, Michigan, for the Capital Area Humane Society. So welcome, Holly. Thank you. So folks that are just joining us, if you want to just introduce yourself in the questions box, that would be great. For those of you who don't know about Julie Jacobson, too, I forgot to mention she's from Tennessee and very active in Tennessee. But she's also very active with our Community Cats Grants program. And if you are interested in finding out more about that program, if you're looking for fundraising opportunities and ideas, you can always email her at grants@communitycatspodcast.com or click on our grants tab, which is down at the bottom of our homepage, and you can find out all the details about that. Marion from Staten Island is here. Carlona, excellent, from Northeast Ohio. So excellent. Thanks so much. Carlona, thanks for going back and forth on the emails. That's great, too. So it's always great to hear from people. Sarah Hollers, hey, from New York City Animal Care Centers. That's great. Thank you so much, everybody, for taking the time to tune in, check in with us on a Saturday afternoon. In my world, it's Saturday afternoon. It could be different times for other people. Let me just jump in and do a couple quick polls. So if you're with an organization, going to launch the poll. What are the key issues you're dealing with right now? Staff, layoffs, furloughs, overloaded with animal intake, fundraising, sick staff, volunteers, or understanding safe protocols. What is, and I believe it says select one or more of the following, so you can choose more than one. So if you're with an organization, what are the key issues you're dealing with right now? So 27% say staff, layoffs, furloughs. 33% are overloaded with animal intake, which is interesting. And then 47% say fundraising. 40% say sick staff, volunteers, and understanding safe protocols. And then there's other, which other is 13%. And let's see what the other is. Hey, Brian, excellent. Fact that Spay Neuter is shut down. And resources for closed TNR. So the fact that there's no spay neuter resources is the key issue that you're dealing with. So excellent. All right, I'm going to hide those results. We'll go back to our screen, and there's Michelle. So we're going to kick right off with our first panelist of the day, and this is McNelly Rivera, and she runs Spay Neuter Kansas City in Missouri. And I want to thank so much, Michelle, for you joining us today. Appreciate it. And the microphone is now yours.
Well, thank you very much. And thank you, Stacy, for bringing us all together. I think the one thing I've learned or I've gained over the last 60 days is a whole bunch of new friends I really depend on, and reached out and called a lot of people in this industry to, see, what are you doing? Help, leaning on people to get us through this, because I think we were all blindsided. I mean, we kind of saw it coming. We kind of knew something was going to happen. And then we were forced to make a decision, and decisions we thought we never would. And we had to do it so quickly. And we didn't have anybody to turn to or to reach out to. We had to just kind of go on a whim and make a decision. Those decisions, I think the stress has gotten to everybody. It got to me enough. It got me sick so much I had to go and get tested for COVID, which was negative, thank God. But now that I've got my stress a little bit better under control and getting better sleep, I'm able to make, some more sound decisions. But, just out of fear, we immediately suspended all of our services just immediately. And I had to make within one day's decision, who am I going to let go? Who am I going to keep? And how long is this going to last? But after the initial shock, of a week or so wore off, we kind of said, all right, let's get back into what we need to do for our community. And for us, luckily, we've been more than spay neuter for so many years. We had a food pantry program, we had vaccination programs, we had resources and outreach services where we were helping our community. And that's exactly what we did. We put ourselves in disaster mode. Let people know that we in the community that we are set up as a disaster center for anything they need, questions answered, assessing sick or injured pets. And then we immediately went in and started distributing pet food to those in need. In fact, we distributed in 1 month what we would in a whole entire year. So as we started helping people and figuring out systems and processes and places to keep us safe and from the public, then we added vaccinations back in by appointment. And we're able to do all of this right now through drive-up service. In the meantime, or at the same time, we still have people calling. We have over 2,000 people on a wait list for spay neuter and over 1,300 behind in their vaccinations. And so we've got the business on the table. We did just receive our loans, the PPP loan and the SBA loan. And so we're bringing all of our staff back Monday, but we're still not quite ready for spay neuter. We want to get some things changed around. One of our biggest struggles, and I'm sure a lot of other people share this too, is our computer software program was server-based. So we are in the process of getting and acquiring a new software program so that we can do everything paperless online. And for us, that also means indefinitely doing curbside service. I don't think we have any plans in the immediate future whatsoever to bring the public back inside of our clinic. Our clinic inside is really, it looks like a disaster center because we have food set up in pallets in different corners. We have workstations and exam tables set up all over so that we can help people at the front door through a drive-up service or a curb drop-off service. So again, I'm bringing all of my staff back Monday, and I think for us, one of the biggest fears there is not so much about keeping us safe with the public, but keeping ourselves safe from each other and really implementing safe cleaning protocols and social distancing between ourselves. That's what scares me the most. Even though we serve a lot of clients, I do believe we have the barriers and the processes set up there to keep us all safe as much as possible. Also for us, we were on June 1st, as planned, we're still going to proceed with it. We are rebranding our organization to the Pet Resource Center of Kansas City, still doing spay neuter, still doing vaccinations, food pantry and other outreach services. But what we are going to start doing next week is actually make an appointment to go curb by curb door service for the lower income pet owners in our community, again, to keep people at a safe distance and not draw a whole bunch of people into one parking lot or one space at one time. So there's some light at the end of the tunnel for us right now. I couldn't think that 2 weeks ago. I didn't know where we were going to be, but I am starting to see some light at the end of the tunnel, getting our key staff back in planning and operations and prep work to get spay neuter back open. We just want to make sure that we get a system in place that's paperless and that all of our processes keep the public and us all safe. That's my number one priority.
All right. Excellent. Thank you. Thank you so much. That's that was like, I felt like that was just drive-through COVID clinic training there. That was great. There's great list of items. I was so busy taking notes, so thank you so much. So you basically, I just have one quick follow-up question. You basically furloughed your staff until you got your PPP loan back, and so now you're
Yep.
bringing them back in and retraining
Yep.
everybody in this new way and all that.
Correct. Yes.
Thank you very much. Excellent. So we have Amber Sitko, and she is with All About Animals Rescue in Michigan, and she can share with everybody a little bit about our organization and what they've been doing.
All right, so I'm Amber Sitko. I'm the president and founder of All About Animals Rescue. We started in 2005, and we've kind of grown from a foster-based rescue to a primarily a spay-neuter clinic. So we do over 34,000 surgeries a year. We 7,000 of those are feral cats, so it's about 20% of our spay-neuter surgeries. We have 4 locations. 2 of them are dedicated to spay, neuter, and wellness, and then 2 are wellness and transport pickup locations. But we do have 5 transport vans that go across the state up to 2.5 hours away. We also have a mobile surgical unit that we use a couple times a year. So before this started, we had invested in about $150,000 into an access to care program. So we bought x-ray machines and things like that. We'd also committed to purchasing a van and upfitting it. So there's another $70,000 that, you know, had we known what we know now, I'm not sure if we would have moved forward. So that was one issue. We also, on March 17th, we closed down our wellness, and then we kept spay neuter going till March 25th-ish, and we closed that down due to governor's orders. The following week, we immediately started doing telemedicine, which has been really helpful. So we've seen like 4 to 6 clients a day. We can't help everybody, but we can help. We try to do our best. And then if we can't help them, we refund the money. But that's been going really well. People are very patient and appreciative of it, and the doctors love it. So highly recommend doing that if you can. We also got the PPP loan. Luckily, we were closed down and we got it like in 5 days. So we got that first round. And I think part of that was due to our relationship with a local bank. We opened up Monday for essential spay neuter on Monday, which is also based on the governor's orders. So we're committed to following, you know, what she orders. And she is allowing shelter and rescue groups to get their pets spayed and neutered, and then essential surgeries. So we're reading that as stray cats, pets that are, you know, male, female in the same household. But we're going to stay focused on cats primarily because they're in the most risk of getting pregnant. And so we're trying to baby step our way into this a little bit, right? So because dogs are harder to maintain that distance. And also cats are definitely have more needs. So that's why we're starting with cats for the most part. Or if we can get the rescues, typically they have more animals to bring in, so there's less people coming to the clinic. Challenge that we've had, some employees have refused to come back to work. Some are just scared, understandably. You know, some live with people that are sick or elderly, and you know, they're just not comfortable, and we certainly understand that. So our focus is on trying to make everything as safe as possible. So anything that we can do, we're doing. We're always looking for new ideals and changing things. You know, people want answers and want to know things, and obviously we don't. So we're just trying to, you know, do our best to make sure people are safe and feel comfortable coming to work. So the process that we implemented for this is that luckily we have a software that's cloud-based, and we just implemented it at the start of the year. So what we did is we took our old surgery forms that were 3-part surgery forms, and we transformed those into the software so that everything's in there, so that we can expedite that check-in process and also eliminate most of that paper going between the client and us. So what we do is we schedule the appointment, we get as much information as possible so that we have less questions to ask the day of the surgery, which is the exact opposite of what we used to do. We used to get very basic information, but now we try to get it all, and even payment if the client's willing to do that. We're aggressively looking at any software that can help us. We just implemented ZipWhip, which is text to landline, so that way when the client pulls into the clinic in the parking lot, they can text us and say, hey, I'm here in this car. My name is, the pet's name is, and then that way we can go into the computer, make sure we have everything in there, confirm services, print the paper, and then go out to the lot to get the pet. We ask the clients, stay in the car. We've separated our liability form from that paperwork, so that way they sign the form using their own pen or a golf pencil, those cheap little things that they can just keep, and then they drop it in a box and we don't touch it. We process it later. Then we ask the client to put the cats outside the vehicle. If they're feral cats and traps, take off their trap covers. We use our own. And then we have somebody inside the clinic. When we bring them in, they load them on a cart, they wipe everything down and take it back. Surgery is done the normal way, and then payments collected during the day. So we're not out there taking a lot of credit cards or cash. And in fact, most people are using credit cards. And since our focus is primarily on shelter and rescue groups, we bill them anyway. So that hasn't been too much of a problem. We do have issues with social distancing. I don't know if people understand really what 6 feet is. A lot of people don't want to wear masks. We prefer, the clients wear masks. The employees are fine with the mask policy, but that's just something. So to combat that, we're looking at printing up some signage, reminding people, what our rules and guidelines are. So hopefully that, takes care of that for the most part. And then we do our surgery video, so nobody comes in the clinic. So hopefully this makes the employees feel a lot safer. We also, that everybody's required to wear a mask in the clinic unless they're in their own room. And we have quite a big clinic. One's 13,000 square feet. The other surgery one is 9,000 square feet. So our surgery area is like 2,200 square feet approximately. So can't always social distance, but it does help quite a bit that we have the space. We also were able to obtain face shields for the employees if they would like to use those when checking clients in. And then any administrative work, we try to have those focused in separate rooms or as far away as possible. But again, the clinic's pretty big, so it hasn't been a problem. We use eVet software. If anybody's curious, it's working out really well for us. We put all our surgery stuff in there. And then during the day, we have, as the pets are finished up in surgery, we're actually having the staff enter all that information into the computer. So that way, when the client comes to pick up, we can just print that out and give that to them. Or if they prefer, we have e-portal access. So the client can just go into their e-portal and look at everything there. So they have that option. So yeah, software has been the key. Online pharmacy we've been using. We did $26,000 last month on it, which is crazy. But it's like a 10 to 15% profit margin. It's not a lot, but it's a good option. We also have a drop off or pick up capability for people to come in and pick up their flea preventative or their heartworm. Because some people can't afford to buy 6 months at a time. They only can buy 1 dose. So we do have that. So what we do is we collect everything over the phone. We put it in a box outside and they come and pick it up. So right now, for the future, we are waiting to see what the governor allows so that we can open up more spay neuter. We're hoping by baby stepping in this, the employees will feel better about it. I don't think some employees, I'm not sure if some employees will come back or not. We'll have to, think through that. We're also looking at doing some wellness that's considered essential by guidance from our Veterinary Medical Association, and like rabies that are required by law, and that would be all curbside. So I'm with Michelle 100% there. Appointment-based, which is exact opposite of what we used to do. We used to do mass vaccine clinics and walk-in based wellness. So that's all going to have to change quite a bit. And I don't see that going back anytime soon. And then we also, the televet, we'll definitely continue to do that. It'd be more for rechecks though, I think, and patients that, just need a quick look or a quick question type thing. But it's it's been working out really well for us. So we'll definitely do that. And, basically, we're taking it day by day. Every day we're open and doing surgeries. We're pretty happy. So, there's lots of unanswered questions, but sometimes when I get overwhelmed, I just say day by day. So, and that's it.
Amber, thanks so much for sharing. And yes, day by day, but it's good. You're moving forward, so that's great. Great news. It's incredible the coverage that you have in Michigan. So congratulations for all the hard work that you guys are doing and your staff. And are you using things in the clinics like rerouting how people are walking, and how, like, I've heard that some clinics are doing like the grocery stores where you're going up one aisle and down an aisle. I mean, looking at traffic patterns and trying to do that as a way of keeping people sort of in their own lane? Or have you not necessarily done that in the clinic and everybody's just doing their best efforts to stay away from one another?
Yeah, so no clients in the clinic, but the employees are wearing masks if they're around anybody else. So unless they're sitting in their own space, they always have the mask on. But we haven't done anything as far as traffic flow with them. The surgery area is pretty big, so I think they can still maintain their 6-foot distance as well. I mean, we've thought about weird things like humidifiers and air exchangers, and but there's just not enough science really yet to know if that's the right thing to do. But that would be the next thing I would look at if we could prove some of that worked.
Great. Excellent. Amber, great. Thank you so much. And so Kelly Duer is a foster care specialist with Maddie's Fund. If you'd like to have copies of this presentation, I did PDF it. It's a handout down in the handout section of your control panel, so you can feel free to download those slides. I also included some of the past handouts from previous pop-up panels, so in case you missed anything, you can feel free to download those handouts from down there. And Kelly, the mic is yours.
Hi, thank you so much. I really appreciate you inviting me to come on today. I'm going to start with a story. This is Apple and Spruce. Apple was found somewhere in Southwest Virginia. She was pregnant. She was in distress. They took her to the vet, and she ended up losing all of her kittens. And so then they put her into foster. And at the same time, somewhere else in the county, there was a litter of kittens who were caught in a brush fire. And there were 3 of them. Mom passed away, but the 3 kittens made it. They ended up putting them into the same foster home as Apple was in. And the kittens were neonatals. So Apple's trying to heal, and these babies are in the room next door. And she starts just going crazy to get to them. She was like, the babies are crying. I need to be there. And she got so, upset about trying to get to them that they were afraid she was going to actually like tear her stitches and things. So they were like, fine. Well, they let her be with the kittens. And so she like fully adopted them. All 3 of them were like her babies. She couldn't obviously give them milk, but she did everything else that she possibly could. When our rescue group took these guys, we decided that we were going to place her with one of them, Spruce. And so the other 2 got adopted. Spruce and Apple, of course, being a bonded pair, they take a little longer to get adopted sometimes. So we were on telling their story all the time. We had, updates about once a week or so. And we finally did find somebody who wanted to adopt them. And what was really neat was it was one of our first Facebook Lives, and we asked the woman, hey, what made you want to adopt them? And she said, well, there were 3 things. One is I saw them on the anniversary of my husband's passing away 2 years ago, and I felt like it was a sign from him. Also, I used to have 2 cats who are a bonded pair who look exactly like them. And the third thing is the story. It really got me. And she introduces me to her son, who was adopted. And keep in mind, right now I'm telling you this story and I'm still crying. The Facebook Live was basically kind of me being a complete mess, but it was one of the most popular posts on our site in that entire month. The stories are really, really important, and they can do a lot of things for your organization. We're going to talk a little bit about, we're going to talk about foster and what's been going on with foster, and how to find fosters. Right now, the public has been rallying around foster in a way that we have never seen before. It's amazing and incredible. And of course, it is different in every community. Some communities are rallying more than others. Another thing that's happening is that shelters are reducing intake during COVID because they have less staff. But what that has led to is, in some cases, what I have heard, that some groups are feeling pressure to take more pets from the community, and more kittens. And kitten season is starting. So while finding fosters in your community may not be a problem right now, since we don't know exactly what's going to happen, I thought I'd talk a little about some of our market research on finding fosters. And especially even when you have a lot of fosters, sometimes it can be harder to find fosters for those pets with special needs, like FELV or ring, if they have ringworm or something contagious, that can also make it more difficult. But I think overall, this happened. I'm not sure that it's in. I think that we're going to see a lot more foster in the future. In the last 100 years, we've come to realize that institutionalization does not work for humans. In every case, pretty much, you put people in a hospital, sometimes they get sicker. You put kids in an orphanage, they have developmental, they're associated with developmental delays, jails. We're realizing, and so with humans, there's been a big trend toward treating people in the home, foster care, outpatient therapy. And I think that that the trend toward foster care for pets is just going to become more important. So I'm going to talk a little about finding fosters and adopters, and even kind of like a little bit of that fundraising strategy. But everything that I'm going to mention really comes down to emotional connection. What we're trying to do is make an emotional connection between a pet and a potential adopter or potential foster, or a pet and or our organization. So we did Maddie's Fund did some market research a couple of years ago on fosters and what makes people really more interested in becoming fosters. What are the things that organizations could, highlight in order to make potential fosters want to actually apply? And one thing really stuck out. So you have this continuum. So the top is most helpful and the bottom is the things that are the least helpful that people can do. And we asked them to rank adoption, donating money, and all kinds of things. You would think when we said foster, that foster would be right up here with adoption. There are some animals that can't even get to adoption, like neonatals, without being in foster. So of course we would think it would be right there. It actually ended up way down here, below donating money, kind of in a muddle with donating supplies and volunteering. And that really said something to me, and I think that it was a big takeaway for everyone, that when we talk about foster, and if we're recruiting fosters, we need to make sure that we tell people how important it is, make it really clear how foster saves lives. The organizations with the biggest foster programs, what do they do differently? This is something I've been this was not in the market research. This was a kind of a personal study. I had been talking to a foster coordinator who had from a very large shelter, and he said that they had gotten a very low number of foster applications in. And after speaking with him, I looked at their social media pages. And on their social media pages, I looked through every day of the last month and realized that they had talked about foster literally 0 times. And so it got me thinking, what are the organizations that have huge foster programs doing? So I went through and tallied about 7 of the biggest foster programs that I know of, about how much they were talking about foster. They are talking about foster literally all the time. They're talking about foster as much as adoption. And so these organizations, in about 33% of their social media posts, mention foster, and not just pleading for foster, but like saying this pet is available for foster or adoption, or telling a story about a pet who's in foster and just being like, contact his foster parents if you're interested, that kind of a thing. So here you can see a couple of days that are almost back to back where Casey Pet Project is talking about foster. So we did in the market research really looked at messaging. There were about 5 or 6 different messages that were tested in the research. This was one of the most important ones, one of the ones that really struck a chord with the most people. Fostering is an important step on a pet's journey to their forever home. A home environment is best for their health and well-being. Fostering cats and dogs allows them to thrive in a home environment and practice forming bonds with their caregivers. For pets who have been waiting longer for adoption, foster caregivers can help reassure adopters that these pets are a good fit for a home and speak to the type of home or family that would be the best match for the pet. So you have a couple of things happening here. You have telling people concretely why pets need to be in foster, because it's best for their health and well-being. Also telling them how fostering helps pets get adopted. That was another thing that the market research uncovered, was that people do not understand the connection between foster and adoption. Also helping and fosters, how they help pets find adopters that are a good fit for them. There are in the handout, all of the messages are in the handout. Oh. All right. There were a couple of other takeaways from that. One of them was the whole market research, all of the market research is linked in the handouts. So just as importantly as recruitment, renewal of foster caregivers is really, really important. So I've heard this fear a lot lately, that now that the shelters are opening back up, that all these foster programs that have put all these pets into foster, all of them are the fear that all of them will come back to the shelter at the same time. And I think people are really worried about that. And there are some things that you can do to prevent this from happening. I don't see this being a big issue. From our research, about 40% of fosters end up failing at some point, which is great. And also we found that emergency foster, whenever there's an emergency foster plea, we've looked at least the data that I have seen, has showed somewhere between about 1/3 and 3/4 of the pets who go to emergency foster don't end up coming back to the shelter, because they're either adopted by their fosters, or their fosters keep them until they're able to be adopted. Nobody wants to bring a pet back to the shelter if they don't absolutely have to. So this is a technique that when we were doing the behavioral foster care study in Fairfax County, I was helping with the data and did some of the fostering for that study. And we were looking at the data, and we realized something really, really interesting. And it was that out of 52 dogs, I think were in the study, out of 52 dogs, about 80% of the dogs were fostered by one of 5 people. And we found this really interesting, because traditionally you think of foster as the pet goes into foster and they're safe. You just, you kind of put them out of your mind and worry about the ones in the shelter. And that what during the study, what the shelter did that was really kind of revolutionary was that they started promoting the pets in foster really heavily. And so we had these dogs who were in foster. They were able to show themselves way better, because they don't have these crazy, like kennel stress and those, behaviors. They get to show people, their fosters, who they really are. And they were able to, and by promoting the pets in foster, the shelter was able to get the pets in foster adopted fast and then fill those foster homes back up. So they're using their experienced fosters over and over and over. During the behavioral foster study, my family fostered, it was a year and a half. We could have had one dog easily for a year and a half. We ended up having 18. So think about multiplying your foster base by 18, except not having to onboard and not having new foster things and, you know, having experienced fosters. It was pretty revolutionary. So in marketing pets from foster, definitely set expectations when people sign on. You can, you know, part of the job, we're going to really need some photos from you of your pets. Let them know that this is something that kind of like is one of the things that you need. Also provide resources that they can reference. We have it is not in the handouts, but I will put it in the chat, a link in the chat. But we have the foster caregiver marketing guide, which is basically a guide for fosters on how to market their pets. Also providing training if you can. This graphic here, it's Pima Animal Care Center has a dog fostering quiz online, and they watch these little videos and then they take the quiz, but they have a section in it about foster marketing so that they can explain what they need and then automate the process as much as possible, because that will make it a lot easier for you. I'm talking about the Fairfax behavioral study. At the same time in Fairfax as that study went on, they were also doing the same thing with cats. So they would take cats who were, you know, fractious in the shelter, or cats who just couldn't show who they were, or like really just long stay cats who they couldn't really get to know because they were just, you know, scared or just not showing who they were. They would put them in foster for like 3 to 4 weeks at a time. And I would say, you know, if we had done a study, I think 100% of the cats would have made it, because the fosters, so many of them left the shelter and they turned into the pets who they really were, and the shelter was able to market them and get them adopted fairly quickly after that. One thing I really like here is that at PAC, they have the fosters fill out a little report card, and then they put it on the back of their kennel card so that people can read it and they know, hey, you know, somebody really knows this pet. And it's so much kind of easier to think, you know, when somebody has had the pet in their home and you have that information, it's just a lot easier to think about having them in your home. Storytelling is I just wanted to touch on this for a couple of reasons. One, it can really help with foster recruitment, but also it can help with finding adopters, and also it can help a lot with fundraising. And I feel like just about every organization out there right now is, you know, in need of this. Storytelling, it's a really, really powerful tool. So there's been a lot of research on it. What they found is that storytelling activates the language centers of the brain, but also the parts of the brain that would be activated if you were actually experiencing the event. So it like basically creates empathy. And the more absorbed in a story the readers are, the more empathetically they behave in real life. So the storytelling creates the emotion that drives people to act. And oxytocin is the love hormone. They did an experiment where they gave participants synthetic oxytocin, and they ended up donating 56% more money than participants who are given a placebo. Oxytocin is something that is released in the brain when a story is told, and some, you know, and people create empathy. So this is Java. She was a foster of mine about a year and a half ago. The shelter told us that she was, that they thought she might have had cerebellar hypoplasia. She also had a really bad cold and they said, you know, she's been in our ISO room and it's full, and come get her before, you know. And so I went up there, And since we knew she probably had a disability, we made sure to take pictures like immediately. Like the before and after are really, really good. They can be really powerful in storytelling and in creating emotional connections with people. So we made sure to get that picture of her in the shelter when unfortunately she looked fairly miserable. We brought her home. We started, because again, we knew that she was going to be a harder pet to get adopted. We started kind of a campaign and really started showing her about once a week what she was doing. Turns out she didn't have cerebellar hypoplasia. She had a spinal fracture. So she was incontinent and she couldn't walk. And so we took her to physical therapy. We did all kinds of updates. And by the time that we were able to, we needed to fundraise for her medical care, people already knew who she was and they knew her and they already had that like emotional connection with her. And so we were able to raise that money. And then when December came around and it was the end of year fundraising, we did more Java updates. So having these pets who people see over time, it helps them to create that emotional connection, and they get attached. So this is me on the day that I realized that we were actually not going to adopt Java out, and we were definitely going to be a foster win. You can see this is like literally the exact second when I was like, I was like, I can't give this cat away, and you can see kind of the mixture of on my face of like, I love you with my whole heart, and oh crap, it's happening again. So just wanted to, I thought that was a fun picture. Also, she is right back here behind me. I'm not sure if you can see her, but my email is here. I'm happy to answer any questions or anything that you guys might have.
Thank you so much, Kelly. That was great. If Michelle and Amber can put on their cameras, so we have everybody here. Excellent. Great. Thank you. So I definitely have questions, but I am going to ask lots of software questions. There are a lot of software questions for Amber and Michelle. Specifically, what software are you using to be able to go paperless? Michelle, I don't know if you want to share first what you're doing, and then Amber.
Sure. We were using Avamark, which was a server-based program, and we are switching to, I believe it's the Clinic HQ, the Humane Alliance ASPCA software program.
Okay. So we're using eVet, which is cloud-based, and we had just switched from Avamark in January. And then ZipWhip, which I think you just posted, Stacy, in the chat. The only caveat on that one, we found out when we wanted to put it on the second clinic that the prices went up substantially, and so we're looking into some other options for that. There might be some cheaper options out there, so I encourage you to check that out.
Excellent. Question for Kelly. What's the best way to do meet and greets now, especially with cats? Fosters aren't comfortable with having people come to their house. And some of the local shelters said that they won't allow people in their buildings, so will not be adopting out cats for months to come. Looking for best practices.
Wow, this is a good question, because I mean, if the cat will go in a harness, you could do it outside. You might, depending on, I think it really depends on the cat, because some cats are going to be, if you put them in like a crate and do the meeting outside, they are not like that. So I guess it really depends. Ideally, they would be comfortable in a harness and you'd be able to do the meet and greet outside. But it's a really good question. I'm gonna have to think on that one about, if you have a really shy cat who, might run, how do you do that outside, or do that in a way that's, I mean, obviously you would be using all of the mask and gloves and things like that, but.
Could you do like a foster to adopt? Sorry. Encourage that. That way the people aren't, if it doesn't work out, they feel comfortable bringing them back, and you don't have to necessarily do the meet and greets.
Love that idea.
And I know of, I've heard of several cases actually where there's organizations that are foster based only. They have no physical shelter. They do a lot of FaceTimes,
Oh yeah.
and there are a lot of cats that they've had in foster care that they felt they would never be able to adopt out, because once the unknown person comes into the room, the cats are under the bed. So they're showing a FaceTime with the cat interacting with the bonded foster home and doing all the stuff, and they're like, wow, this cat's wonderful. And they coach them, and they say, the cat may be under the bed for several weeks, but this is what you can get to with time, love, and patience. And there have been quite a few cases that I've heard of where successful adoptions have happened with no pre-contact with the adopter. It's just through video, and it's worked out really well.
That's awesome. That actually might work better for those. I mean, it seems like it would work better for those cats than an in-person meeting anyway. Because I have had fosters who, try to hide, and then like the adopter is, potential adopter can't really get to know them, but they can kind of do it much better if it's online.
Okay, so let me go through here. Sarah from New York is saying, we're doing most of our adoptions through virtual meet and greets, and it's been amazing for the shy cats. Gotcha, good. We're considering doing, this is another comment, we're considering doing adoption events with fosters using Zoom breakout rooms as ways for potential adopters to meet many animals at once in one event and put in their application. So have like a Zoom room with your cats. That'd be pretty interesting.
I've heard of organizations doing this. It sounds really cool.
So that's another idea. So I'm going to throw out this idea with the whole sort of reinventing the sheltering world. We're taking this opportunity to reinvent things. We have so many cats out in foster. We have so many cats and kittens that are going to be rescued by the community over time, because folks aren't going to be rescuing them because there's limited access to spay, neuter, and that kind of thing. And so that shelter pipeline has pretty much slowed down. So we're depending on the communities to be our shelters. That's what I'm hearing. So community members are going to, they see an animal in need, they see a cat in need, they see a situation in need, they're going to act, they're going to respond. Therefore, their first point of contact is going to be the low-cost spay neuter clinics, because they're going to want to assist those the cats and kittens that they're dealing with. So it's really, the community is going to become not only our shelters, but may become our foster homes too. And that's not necessarily a bad idea, because here we're talking with Amber's talking about doing telemedicine. So they might get a phone call, what sort of assistance that they need and what would be the next thing. So I'm even wondering if there is going to continue to be less of a demand in the sheltering world, but more of a demand of the clinic world for that supportive wellness care. I didn't know if any of you had any thoughts on that sort of picture of what things look like down the road, if that our spay neuter clinics may be needing to be more supportive to that population.
I think more outreach based, more focused on pet retention and shelter intervention. That's why we're rebranding it and focusing on those people who sometimes they don't necessarily claim it's their pet, but they're feeding it, they're taking care of it, dogs and cats, but getting them just to invest a little bit more, get them over that hump to actually claim them and do take them in and care for them, but providing those resources, the education, the low-cost services, the vaccinations, the preventative, and basic, leashes, collars, pet food, litter, just those basic things to get them over the hump of just own it now. Now take it into your home and keep it forever. That's kind of, our new focus and rebrand. And I think it's going to be the next biggest movement, and something shelters should look into adding on besides just pet adoptions is shelter intervention and pet retention.
And also making sure that those services are provided from at whatever stage, that the clinic's going to be the contact. So like you'll get first, assistance maybe while this person has the cat or kittens, and then they get passed on to another family takes the kitten, but they're going to still have the same contact with the clinic and that kind of thing. So, Amber, I don't know if you had any thoughts on that.
We integrate, or we work with a lot of different partners already in the shelter, the animal control. So we try to help, intervene if they're extremely sick. We'll provide some temporary care and things like that. And we work really closely with the rescue groups to get them spayed and neutered. It would be a challenge, though, for us to take on a lot more. We're already so overwhelmed with what we have and trying to find vets, and we have an outreach program as well. So we definitely need those rescue groups to stay involved, even from just a contact and adoption process and so on.
Kelly, any thoughts?
I think access to care is going to be a huge piece of the puzzle that we use going forward. That like the foster care, we're going to probably house most of the animals in homes, and also hopefully keep them out of the shelter by giving people more access to care.
Yeah, that was the program that we bought all that equipment for that we were just starting up. So yeah, I totally agree there.
So I have a question for you about for Amber and Michelle, for the partners and the organizations that do have trappers or volunteer trappers or do return to field programs. Are they up and running? Are they trapping? What are you hearing from them?
They're definitely they want to trap, and we just started Monday. So yeah, we've got actually somebody started a petition, and the last time I checked, they had like 2,000 signatures on it to try to get us open again and spay neuter allowed. So they're definitely eager, and we're definitely seeing them. The shelter one, I'm not sure about. We do have like an SNR program with one of the shelters, but I'm not sure what their status is.
Yeah, our community's anxious too. They're pushing us. We're just not ready yet. We've got to make sure we're safe first.
I'm finding that there are trappers that are out there. They're doing the trapping, and then they're bringing them in and they're fostering, and they're getting themselves pretty loaded up. And so I wonder about how, then there are the shelters that are emptied out and that they really aren't getting many phone calls or anything like that, but they've got 300 people of foster homes waiting. So there's this disconnect happening potentially out there for those that are out there trapping for emergency situations. And I know you can't pick the cat you're going to trap unless you're a superstar with the drop and all that kind of stuff. And but yet there's just so much need out there, and every cat can have complications that you're not going to know about out there.
Yeah.
So that's what people are having a hard time dealing with, that, there are cats out there that could be having complications in birth. I mean, everybody's pregnant. So, and otherwise you're a male cat, but all the females are pregnant right now. So that's the worry, is that you're going to miss the one that's not going to have a good delivery.
Yeah, that's why one of the reasons we're focusing on cats, and specifically stray and feral cats, is because of everything you just said. And the other great thing is if you have trappers, they're doing multiple cats, so you have less people flowing through your clinic, even in that parking lot, right? So that's why we made the decision to, do very limited dogs. They're not as high risk, and focus on those feral and outside cats. It's just a great way to ease back into it, because like our first week when we were doing those types of folks and rescues, very few people were showing up because they were bringing multiple animals, but yet we were still filling our surgery schedule.
I have another question for Michelle. I believe, just to confirm, did you say you were going to Clinic HQ as your new software?
Yes.
And what software were you before?
Avamark, the same as Amber.
Okay, Avamark. Okay. All right. So I believe, Donna, tell me if I did not answer all your questions from that standpoint. The questions from this presentation just will not be emailed to everybody. just so you know that. But if you do have a specific question that we don't get to, then we will also, I'll get it to the folks here. All right. Here is a question. Here is, we're still doing, this is Vona from The Real Fix in Kansas City, Missouri. I don't know if you know her, Michelle. We're still doing TNR, but it's difficult with only one low-cost clinic available, no mass trapping possibilities due to no mass feral fixes, which that makes sense. So hopefully everybody will get online. I know Michelle is as eager as possible to get up and going. So it's very stressful. I can tell you, I feel the pain of the folks out there that are traditionally out there trapping a lot, because they're really feeling like the colonies that they had a chance at getting under control are not going to be at this point in time. So I know everybody is feeling that. I have 4 minutes left. Anybody have any final questions? Whoops, this one. We have Catherine asking, magistral usage. Is anybody using that? Does that mean anything to anybody for anything here? No? Amber? No?
We had looked at it. It's whatever the product, you can put it in the cat's food to.
Oh, right. Feral, like feral fat. Yeah.
Yeah, to delay, heat cycles. But there was just so much unknown about it that we didn't proceed. So I think that's why Catherine's asking to see if anybody did it. Because I think we're all talking about it, but there's just not enough information. So if anybody is using it, we'd certainly be interested in hearing from them, all about animals.
And I believe Maddie sponsored a presentation on that at one point in time too. That was a few weeks back. Yeah, Michelle,
yeah.
What do you have?
If you can just put my email up, we have a private group Facebook page for Spay Neuter groups, just kind of to share ideas, network, and help each other. If anybody's interested in joining, just have them email me and I can send them a link to join.
Okay.
And then,
all right.
Stacy, can I just add one suggestion?
Sure. Yeah.
We at our clinic, we have a little room that's accessible from the outside via key card, that known feral trappers they have the access code or whatever they need to get in there along with the shelves and all the paperwork in there, so that they can bring them in, the night before, and then we just grab them for surgery the next day. So I hadn't really thought about it till now, but that might be, if people have that option, that would also limit your client contact, because the trapper's already registered to you, they're well known, and they can just put the traps in there and go, and then there's zero contact. So that might
what
be
we're looking at too, is like self-serve kiosks set up for known trappers.
Yeah, so I think that might be helpful for some people.
And I have a question here from Denise. I'm sorry, Denise, I missed it scrolling through earlier. For Amber, this is a question for Amber from Denise. How do you deal with the VCPR requirement with telemedicine?
Yeah, that's all a little foggy. So, people argue different things, but for us, the way we've implemented it is we're only, for the majority of the cases, they're previous clients, but we see, we did 34,000 spay neuters, we did, I don't know, 50, 60,000 wellness clients. So there is established relationship there in a lot of cases, and I think the vet's done just a handful were very basic, something that like a ear infection or something that she felt comfortable with. Because in Michigan, it's very murky. It seems like it's allowed, but the MBM, the Medical Association, hasn't come out and made it super clear. So that's how we're handling it.
Great. And I'm just going to hold for a couple more minutes. I did put Michelle's email up in the chat. So folks, if they want to email her to get an invitation into the Spay Neuter Facebook group, that would be great. Folks can join there. Before we close out, I want to do one last poll for folks just to see where people are at this week. So it's going to be our last poll. So how are you feeling this week? Great. I think I can handle whatever comes our way. Good. Not sure this is going to be pretty, but we'll make it. And very anxious. I'm losing sleep at night. How are you feeling? 20% of you are feeling great. I think we can handle whatever comes our way. 60% say good. Not sure this is going to be pretty, but we'll make it. And 20% are very anxious, losing sleep at night. So we're starting to get kind of spread all across the board again a bit. So I think with uncertainty, we're having a hard time. There's just still so much uncertainty out there that makes things really challenging. So each week it's changing your whole business plan, your whole way of operating. It's something new. I was on a call yesterday and they were like, we heard we could do this, but we don't know the guidelines. And therefore we have to wait until the guidelines come out next week. So we can't even plan and we have no idea. So it's very frustrating. And conversations about summer camps for the organizations out there that have summer camps, they're all freaking out and wondering whether they're going to be able to do them or not do them and all that kind of stuff. And that's a big moneymaker for a lot of organizations is the humane societies and stuff, animal welfare groups. A lot of them have a pretty financially revenue generating summer camp that's really good for the organization. All right, so our next pop-up panel is going to be on Monday at 4 p.m. and Eastern time. And we have Sophia Hernandez from Fix, Adopt, Save. Sorry, I may be messing up her last name. Amber, you probably remember it better than I do. And then and Donna from Tate's Every Animal Matters out of Connecticut, which is a mobile spay neuter clinic. And then our third guest is still to be determined, but we will be back on Monday at 4 o'clock. And I want to thank Michelle, Kelly, Amber, so much for joining us today. I really appreciate it. This will be posted up on YouTube. If people are desirous for the recording, like within the next 24 hours, I can give you a rough cut, but Kristen loves it when people are going to YouTube and watching those videos. So I want to say thank you again, and we'll see everybody on Monday afternoon.
Bye.
Bye.
Thank you.
Thank you.